Hello, everyone. Welcome to the TRT and Hormone Optimization YouTube channel. My name is Danny Bossa. I'm joined today with our new host, my wife, Angie Bossa.
Hi.
Not only is she beautiful, but she's super, super smart too.
Oh boy.
And our special guest today from Dublin, Ireland. She is a functional medicine doctor, and as well as being a two-time Euro drug-free powerlifter. Please welcome, on the subject of women's hormones and everything related, Dr. Fionnula McHale.
Hi.
Hi, welcome.
Welcome to this channel. I am Dr. Steven de Vos, the lifting dermatologist, and this is my partner Danny Bossa. If you want to learn more about the most cutting-edge science-based information in the world of hormone optimization, please like and subscribe. I also invite you to join my other YouTube channel, The Lifting Dermatologist. The link you can find in the description of this video.
Yeah, very close friend of our good friend, Dr. Eric Serrano. It was Eric Serrano that said, we really need to get her on. She really knows her stuff. And who better to interview Fionnula in regards to women's hormones than my wife, who's going to have all the questions about women's hormones. So I thought that worked out perfect. So you guys take it away, and I'm going to go take care of a crying baby upstairs.
Okay. I think we also forgot to mention that she was a functional medical practitioner.
Yes, we did.
Yeah, I'm a medical doctor, I guess, by background conventionally, and then I suppose functional medicine came thereafter.
Okay. And also, I think she was a speaker at Swiss 2018, which is coming up again. We're going to go to in the fall, so that'll be. Are you going to be there or?
I'm not 100% sure. I tend to not plan that far in advance, to be honest. So we'll see. But it's an amazing event. Like, I highly recommend it. Absolutely incredible event. Yeah.
Awesome. So maybe you can start just by telling us a little bit about yourself. I know you have two practices or one practice or...
I stick to Ireland, but I do see clients all over there. Yeah.
Okay.
So I guess, like, in terms of my background, I studied medicine in Trinity College here in Dublin. To give you a bit of background, because I think it shows like how I got into what I do at the moment, I would have definitely been very science focused. So, for example, both my parents are scientists. My dad's a professor, my mother's a lecturer in biochemistry. And so I grew up loving science in the sense that, like, when I was a small little kid, 4 or 5, 6, we'd watch these videos on how my body works. Or I used to do competitive swimming, and, you know, my mother would have the sports nutrition book out, and we'd be taking whey protein back then and everything. So I always had this huge love of science. And as a result, I would have done things like the Young Scientist exhibition here in Ireland. And I did a project like on fuel cell technology, and my first paper published at 15. So that kind of always gave me that love of like science, of the molecular side of things. And I suppose midway through studying medicine, we do it as an undergrad here. So, you know, I was quite young at that stage, but I became unwell myself. And I started to realize that, you know, the medicine model that I was studying wasn't really catering for what was going on with me. And that obviously was quite frustrating, as you can imagine, because, you know, one issue would crop up and I get a medication, then I get a side effect, I'd have to take something else. And it just seemed to, like, by the age of 21, I just had about 5 medications I was due to take. And I just found that the approach was not really suitable to me anyway. So I started to... Yeah, that's exactly what it is. And I suppose that's how I got into functional medicine, which is ultimately root cause medicine, because I didn't feel like anyone was trying to figure out what was going on with me. It was just, what symptoms do you have? You fit into this box of whatever the diagnosis is, and we give you this medication. That doesn't work, we try another one. You get side effect, we take another medication. So I didn't like that approach because it didn't really, for me, it kind of took the science out of medicine. You know, like if we even look at something as simple as how the cell biology works, like there's so many intricate processes that take place just to make ATP that I couldn't understand how the approach is the exact same for every single person. So again, that kind of was what spurred me on to like study more in the functional medicine side of things. Actually, it was Charles Poliquin. I don't know if you've ever met him or come across him.
I've heard a little bit. Yeah, go ahead. Yeah.
Yeah, so he was one of the big influencers, I suppose, in shaping my career, because at that point I was studying medicine. You know, I was on a fairly linear trajectory to being successful in whatever field I chose. I would have been quite a high achiever, but I just found this functional medicine. I used some of the tools to help myself, so I got off all the medication, and I felt like I was getting back to myself. To give you a brief summary, I would have had gut issues. I would have had no periods for about 2 years, and I suffered significantly with mood disorder, depression in particular. So when I did some of the functional medicine tools, I just randomly had picked up there wasn't really any structure. I didn't go to a functional medicine practitioner. I saw the huge impact that it had on me. And as a product, I went on to learn more purely for my own interest, to be honest, at the start, because in Ireland, anything that's not the norm is sometimes perceived to be quackery, or, you know, you're just, it's kind of maybe a bit airy-fairy and there's no real science to it. Nutrition, food, herbs, supplements, kind of a bit, you know, it's not too scientific or structured. And so the functional medicine studies brought the science back into medicine for me. And from there, I pursued that career. So obviously I finished my studies in medicine, did my intern and all the rest, and did specialties or whatever, but in the background doing the functional medicine and starting to build up the practice. So I've been practicing now for 10 years nearly. And I think it's the best thing that I ever did. So I absolutely love it. And I suppose to give you an understanding for anybody that doesn't know what functional medicine is, it's ultimately root cause medicine. So it's not any better or worse than conventional medicine, but it's just a different approach that applies particularly to people with chronic diseases. Okay. So let's say somebody breaks a bone, they need to go to the doctor, they go to the hospital, they get the bone fixed. Or somebody's acutely very sick, they need to go to the hospital, get a drip, they get the bloods, and the bloods show what's going on, they have an infection, they need to get a drip, antibiotics, IV. Now, for somebody who's out there with a chronic condition, so they don't need to be in hospital, but they're not really at the peak of their health. Sometimes you have clients that I see, they have very complex symptoms and signs, but actually the bloods are showing nothing. So
like
that's
fibromyalgia for one, or something like that.
Yeah, exactly. Or even, you know, like issues with periods, as we're going to be talking about soon. So menstrual irregularities, like the solution with conventional medicine is just give the pill. You know, short of that, there's very little that they actually do to help the hormonal imbalance or solve it or find out what's causing that hormonal imbalance. So functional medicine is almost takes an individualized approach to things too. So it's more personalized in the sense that we use different testing. So what becomes problematic in conventional avenue is the testing. So let's say and there's still a role for that, don't get me wrong, but a lot of the time when we have chronic diseases, those bloods don't necessarily show us what's causing the problem. And like I said, you'll have people with a whole pile of signs and symptoms, but no real objective diagnostic data that gives us an idea of what's causing it, you know. Even if you look at autoimmune conditions, which I know you want to talk about later, sometimes people have all the signs and symptoms, but not yet displaying positive results on the blood test. So what would we do in that approach? We just sit around and wait for it to get so bad that the bloods test positive? No, functional medicine, we figure out, okay, where's all this coming from? What can I do to abate the symptoms and prevent it getting to the stage whereby, you know, I'm incapacitated to an extent, you know, and I get one autoimmune disease, then I get another diagnosis, and it goes from there. And then you're looking at heavy medication to solve that. So functional medicine I often like to do it in tandem with conventional medicine or GP. So I think it works best when both avenues come together. So I'm fortunate that I have the conventional medical background, but equally I haven't practiced in that capacity for so long that I like to get a second opinion, send to a specialist, rule out any major causes of ill health, and then nothing is showing up, I can help, or we can help alongside that person, you know.
That's amazing. So you're really getting at the root of the issue, the underlying problem, not just treating the symptoms. You're looking at the body as a whole, if I'm understanding.
Exactly. And oftentimes people confuse it with like alternative medicine, in the sense that, like, when we're looking at even taking supplements, so a lot of people will ask me, okay, what supplement do I take for this? So I have this symptom, what supplement do I take? And that's not really what functional medicine is. So it's like, if you take that approach, you're just using a nerve instead of a medication. So that's not really what we're looking at. We're still trying to figure out, why is this happening? Of course, we can use herbs like adaptogens or things like that to help in the immediate immediate circumstance. Let's say while we're waiting on tests to come back, or I might speculate as to what might be causing the issue and treat in that way. But ultimately, the goal is to find out why these symptoms are happening in the first place.
Okay.
You know, the fortunate thing is, once you do that, you can often use more natural means of getting the person well, i.e. food, supplements, and exercise, vitamins, minerals. They can do a whole world of good.
Sleep.
But equally, sleep, stress management, all of these things. But equally, there needs to be a structure to it. So like I always say to people, there's no perfect diet for everybody. And equally for one person, a diet that might work for them initially might need to be altered as they go through life. And that's the same, like if we take a training program, for example, we might do it for 4 weeks and then we adapt. So we have to change it. It's not, we need a new stimulus, or for example, in the case of diets, things might change, you know, so
different goals, different areas of life.
Exactly. And I suppose it's the understanding that diet, a lot of us attribute diet to lose weight or putting on weight, but actually food can do far more for the human than most people know, unfortunately.
Yeah, well, it goes back to the you are what you eat, but I mean, I think it's just, it's a lot more than that even.
Absolutely. And even like small changes in macronutrient distributions can have a huge impact too, you know. But equally, if the diet is poor, it can cause a whole pile of problems. And that's a lot of what we're looking at too. You know, like poor food and stress is probably one of the biggest contributing factors to chronic disease.
Absolutely. So when you, like, say if a patient comes to you and they have, you know, a multitude of symptoms, I would imagine you'd start by doing a detailed patient history. Like you would look into, you know, whether they took, if it's a woman who has menstrual irregularities, she took oral contraceptives, or so what exactly would you do if someone presented you? How would you go about, what's the first thing you do usually?
Well, I guess the first step really is the history. And, you know, it's not a short 15-minute chat about what's going on symptoms and signs-wise.
That's it.
But rather looking at the patient's timeline. And that's a crucial role of interviewing a client, because there's a myriad diagnostic tools we can use. And it's important to be able to streamline where we're going to go, aside the fact there's a huge cost involved in testing. And equally, what we tend to forget as scientists or our medical professions is that there's another whole area of wellness that we tend to neglect, not by choice, but I suppose I have an appreciation for it now by virtue of my own health journey. So, and that is the role of psychology. So the role of stresses, traumas, and major life events in shaping our brain biochemistry, going all the way back to childhood experience. So that being such a huge contributing factor to so many issues later in life, whether you're looking at hormone issues, but particularly mood disorder, and often not manifest until, let's say, the 30s, 40s, you know. So those things, I think you need to have a good clinical acumen, not only to be able to understand the importance of it, but also to be able to extract that information from the client in a way that doesn't send them over the edge. So let's say people might be talking about childhood experiences that are quite traumatic. They may not have thought about them for so long. And the other benefit of doing a detailed history, like obviously the medical history is relevant, but that's usually something I get them to fill out a form before they come to me. And it's easy to say, in 1998, I had tonsillectomy and I went on this medication and this is what happened and I did this diet and all the rest. It's easy to document those things. But sometimes it's only when we put together a picture of our timeline of what else was going on around the time this happened. So, you know, maybe there was a big financial issue, or, you know, there's a huge work stress going on, or someone is in court battle, or, you know, those issues with the parents, parental separation, and these things came about. And sometimes the patient themselves doesn't even realize the timeline until they speak it out to me. So that in itself,
or they write it down.
Yeah, exactly. Or sometimes, like as a clinician, you can ask questions that makes the client think about something that they completely forgot, you know, because I'll often get people, they've done the detailed form before they come in, they'll be like, oh yeah, I forgot actually to put that down, you know. So the history is a huge part, and it is detective work, you know, and sometimes the art of that is neglected in the conventional medicine. You know, I suppose we go to specialists and they just ask about, if it's endocrinologist, they just ask about the hormones. They don't know anything else going on. Or the gastroenterologist just wants to know about the gut. Don't tell me anything about your hormones or your mood or anything like that. But what I have an appreciation for now, by virtue of my own health journey and with working at many clients every day, is that things don't happen in isolation. There's the physiological effects of the interconnectivity of systems, but also the psychological component. And, you know, it is an important part of people getting well, like whether we're talking about hormones or gut, you know, gut huge, the psychology element. But people can get profound benefits from those things without having to take a whole pile of supplements or hormones or whatever it is they want, you know. So those things I like to rectify before we start going down the road of any more invasive treatments, let's say.
I think
Or
it's
potentially
also
side
sometimes,
effects.
yeah,
Go ahead.
it's
Sorry.
also sometimes the patient, no, don't worry. I think it's sometimes the patient doesn't realize that it may be relevant. They may think that, oh, you know, this divorce that I had or this childhood trauma has nothing to do with the fact that I have gut issues today, or that I have a mood
Well,
disorder or
exactly.
things like that, you know?
That's
So it's
exactly the
really the
case.
whole body.
Yeah, but it's an important point that you brought up there, because, you know, that's again an important part of seeing the client and getting them better, is that they have an awareness and an appreciation of the role of these factors in their health condition, because unless they understand it, and again, you can't give them a whole pile of medical jargon or research papers, because they're not medical professionals. They're not expected to understand those things. So you have to be able to explain it to them so that they understand how much it does have a role to play. Because, you know, like I said, I'm the first to admit that, you know, I am very open about the fact that I had a very adverse childhood experience. And in the past, I would have said, oh, you know, that happened when I'm a child. I didn't know anything else. So for me, it was normal. So I don't need to deal with that. But lo and behold, as a result of doing the hard work, it has been the most liberating experience. And I find the same for clients, you know. And I suppose that's why I know how important it is because of my own experience, you know. And I always think that sometimes you often find people in fields and you wonder how they get into it. And the people who've got into it because of their own ill health or their own poor experience tend to be much more compassionate, understanding, and everything else in terms of helping people. So again, a lot of the stuff that I do would be mood disorder related as well, because I understand it, you know. I have the compassion and, you know, the right words to say to people, you know, how to manage them if they start to cry, or all of those experiences are really important in developing that trust connection with the client. You know, like functional medicine is a mutual therapeutic journey between both the clinician and the patient. So the patient has to trust what you're saying, because well, I don't know, probably better where you are, but in Ireland, functional medicine is kind of seen as, oh, I'm not really sure if this is going to work. You know, like nothing else is working for me, so I just try it. Like, most clients come to me at the end of the road. They've tried everything, nothing is working, and they're like, oh, I better go try this one. Like, you know, like
the 11th hour type thing. They're like, they really want to get to the root.
And
they're like, okay, I'll just see if this works.
Exactly, they just have no hope left, and you go, I better go to that one. Like, I've heard she does some funny stuff. Like, so.
That's awesome. So what type of like, I know on this site, I think it says you do advanced diagnostic testing. So what type of testing is that actually?
Well, I suppose if we say advanced, we're really looking at a lot of the functional diagnostic tools. So one of the big ones would be the stool testing, because, you know, we'll probably go into it in more detail, but the role of the microbiome is only becoming more and more apparent in overall human health.
It's huge.
That's the thing, you know, often people, they think, oh, it's just my digestive system. Like, you know, I don't have any issues with my gut, you know, so it's not always that cut and dried, but the gut and the bugs in the gut have such a huge role on even how we digest and absorb food at a simple level, the immune system, hormonal metabolism, and indeed the connection with the brain. So the neurotransmitter balance, inflammation, all of these things. So it's really somewhere that I do a lot of diagnostics in that regard, and get a lot of valuable information that helps the client. And the test itself has advanced so much at this stage. You know, in the past it was purely microbiology. Now we can do PCR, which opens the doors for being able to see more than we could in the past, so let's say. From there, also looking at things like the NutriFab is a great test. So what that is it's urinary marker, urine and blood, and together we get an assessment, I suppose, of organic acids, which gives us an insight into nutritional status. So the requirement for that individual. So remember, the vitamins and minerals and needed as cofactors for metabolism. And so just measuring the blood level doesn't always give us a great indication of how that person is using the nutrients in terms of each of the metabolic steps. So that's a really nice test. We also get an idea of the fatty acid ratios, heavy metal levels. What else are we on that test? Neurotransmitter metabolites, which are You know, it's hard to know how valid they are, but they can provide information that's often consistent with the patient's experience of mood symptoms. So I wouldn't write it off completely. There's also markers there that would indicate dysbiosis, or, you know, whether it's fungal overgrowth or bacterial dysbiosis, whatever that happens to be. Then when you come to hormones, I suppose traditionally we'd still use the blood panel, you know, so to look at all those.
How do you feel about the Dutch test for hormone testing?
Yeah, I don't really use it, to be honest. I know a lot of people do, but I like to stick to the tests that I know. Like, I know Erkie's, I know there's a guy, Owen Lacey here, who does a lot of it, but I just don't have a huge amount of experience with it, so I can't really offer an opinion in that regard. I do like the urinary metabolites. Now, the Dutch, from what I understand, checks it on different days and different times of the day, which is hugely relevant.
It does, but like, also cycle mapping for the whole month. So for women who like want to see like what their hormones are like throughout the month, it kind of gives you like from my understanding, but.
Yeah, I have a test that does that too. Like, it would be with Genova, but it's not the actual Dutch test. So when it comes
saliva
to hormones as well, saliva.
Yeah,
but again, I wouldn't really. You have to be careful, obviously, with those diagnostics. I prefer the blood and the simple urinary metabolites, you know.
Okay.
But that being said, when I'm dealing with hormonal conditions, like, sometimes the hormones are well down the line of the test that I will do, because for most people that come in, they've poor diet, they've a whole pile of other issues going on, and first and foremost, they need to get healthy before we start looking, because you know, it's like doing a stress hormone profile. Sometimes you already know it's going to be off before you even look at it. So we look at things that they can start to intervene with, and then we do all of those, because we're also conscious of cost of these tests too. So I like to be strategic in recommending diagnostics, in the sense that if they're coming with, you know, gut symptoms, or, you know, some, especially women with like menstrual irregularities and all the rest, they'll often have already done the hormone test anyways with the GP. So I like to look at other areas I can get them to be better at, food-wise, supplement-wise, and then we'll see how they're doing hormone-wise. Most of the women, they get them. If they have no period, the period comes back once we address all those issues, and they're fine, you know. Menopause is obviously a slightly different situation, but let's say the menstruating female, they're probably well down the line of the tests that I do. I like to get it, like, even for example, the role of insulin in hormone imbalance. So those things, the thyroid. So when we're looking at the advanced diagnostics in Ireland, anyways, they'd only really look at like TSH. If sometimes they might do T4, sometimes they might do the auto antibodies, and it's rare unless you go to a specialist endocrinologist that even do the T3. So with
doesn't really tell Genova, you anything.
No. So with Genova, I can do obviously all the other bits and pieces, the T3, the reverse T3, and all those things which are nice to have.
So are you saying that you're kind of looking at, like, I know you had said where in the beginning that doctors were just giving you medications to treat the symptoms. So do you kind of look at maybe hormones being too overprescribed, and maybe that they should look at to fixing something else before they go into the hormone route, and make sure that everything is stable first?
Perfect. So remember, when it comes to treating the patient, we want to use the least possible interventions with the least possible dose. So if I know, even in the case of menopause, like some women might need a bit of hormone support, for obvious reasons, the ovaries aren't working as well as they should. However, I prefer that they work on the other things that can be causing them to feel way worse before they start going to hormones first, because, you know, there's so many other things that can make them feel a lot better. And the problem sometimes becomes, if they take a little bit of hormone, they start to feel better, and then they scrap the diet, they scrap all the supplements, and they come back, I need more hormone. You know, the sex drive's going down now, so I think I need some more testosterone. So, you know, that's my approach. Not everybody would take that, but again, working with people, they're all very different, and the strategies can be different for different people, because you're dealing with the person's psychology too, their mindset. That being said, some women give them a little dose, and then they're more motivated to intervene with food and stuff. Interventions. But if we're looking at the menstruating female, exactly, and you can do a lot of work without having to take the hormones. First of all, again, it depends on the stage that they're at, you know. But the menstruating female, they can get a lot of results, whether it's PCOS, endometriosis, dysmenorrhea, or not having periods at all. And acne, all of those hormonal types presentations, they can get so much improvement from even just reducing the carbohydrates.
Yeah.
You know, like people know when they come to me, it's not going to be simple. They're going to have to do the work. Like I can give them the best advice in the world, but unless they go home and do what they've been told to do, they're not going to get well. And I'm not going to just give them the hormones that they're looking for. It's not going to be that straightforward. If they want that, they go to GP, you know?
That's it. Yeah. You have to
And
do the
you'll
work. You
always
have to put
have
the work in. And I think with diet, I think it's so hard in the beginning, but once you actually, you know, get on the track and you get into it and you're doing it all the time, then you'll consistently find more recipes. You'll find more things that you actually like eating. You'll enjoy it more. And when you start to feel better from doing it, maybe you'll just get addicted to feeling better. And you don't want to go back to feeling like crap all the time.
But that's it. And it's great to turn, because in the sense that when people, let's say they come from a very poor diet and they start to eat relatively clean, they do feel so much better. And then they might say, oh, screw this, I'm better. So off they go and they have pizza. And the next day they're on the phone like, oh my God, I hate this. You know?
Yeah.
So like it's a great deterrent. Now, a lot of the times what I will do as well, like say if I have someone, I do stool tests from both patients. And those who come back with dysbiosis, whatever is good, might have a parasite, they might have fungal overgrowth or whatever it is, bacterial issues that need to be rectified. They might just have low growth to good bacteria. I'll often do like a medical food period, so they're not having any real solid food. So it's almost like a fasting mimicking diet like we see in the literature, which quickly rectifies any existing dysbiosis. Now, if there's microorganisms there that need to be pathogenic type stuff going on, that often needs pharmaceutical medication to get rid of that. Not always, but a lot of the time. And so I often use the medical food, the fasting mimicking diet, and that obviously it has an impact on the gut, the microbiota, but it also changes people's cravings by virtue of obviously the microbiota has a huge impact on the brain.
From my understanding, it's the bacteria that causes the cravings in your body. So if there's like an overgrowth of a bacteria that likes carbs or like sugars, that's what causes the cravings. If I understand.
Well, there's also different signaling molecules like leptin and ghrelin, and like it depends on the person too. If they have underlying psychiatric issues, there can be problems there as well. So, you know, it depends on the patient too. But yeah, there is some people will say that they crave the foods that they're probably not supposed to be having. Often people with parasites will crave certain foods, like raw fish, for example. So, but it changes. A lot of clients will come back after the month and they will definitely note that they don't even want rubbish. Like they can walk past anywhere, like with bakery treats, which they would never have been able to do, and they don't have that like overwhelming desire, like, you know, which is another good way of starting them off. Because let's say they've done the fasting mimicking diet, they're just so excited to be eating anything by the time they get to the whatever it is, like they might do 5 days and they get to 6 days just so happy to have a chicken breast. So you know, it is a good way of starting things off for them.
I had my own journey with that. I had SIBO for 2 years in 2015.
Oh, okay.
And I think I dropped down to like 95 pounds. It was impossible for me to gain weight. And I literally, I must have went to like 5 different doctors, and they kept giving me Metamucil or telling me everything was fine, or just telling me to cut out coffee, or I forget what the other one had said. They, Imodium, just like things that just treated the symptoms that did nothing to fix it. So then I went to a naturopath and we did a stool test. I think I had an overgrowth of Oxytoca Klebsiella, I think it was.
Oh, okay, yeah, Klebsiella oxytosa.
Yeah, so we treated with Intestinu Renew Life. We did herbal antibiotics. We did a lot of probiotics. I cut carbs out of my diet. I cut a lot of sugar out of my diet, and then slowly, like it started to get better. I still have a little bit once in a while, so I don't think it's completely gone, but someone recommended ox bile. That was like a good supplement for it.
Was there any issue with the enzymes on the test?
You see, this was in 2015. I don't know that enzymes were tested. I think they really just wanted to get an idea of what the bacteria was like in there. So I don't know how intensive or how like deep the test went into. Maybe it could have been a little bit more extensive than what was done. But
yeah, and like I think 2015, I don't know, were they doing the PCR back then? So it might be no harm to look at like the GI effects, because I know I have a few people in Canada, and they are doing the GI effects over there. So that'd be no harm to look into.
Okay, so what is it that you said they test? They test for.
It's the
enzymes?
PCR. So they will look at enzyme function as well, which is great because like a lot of people will have issues there. Again, with that in mind, if anybody is doing, I think in the US and Canada, anyways, you have to have a prescription from a doctor to get the test. But I suppose it's important, I always think, to have the food diary alongside the stool test so that you're not getting unusual results. But the stool test can offer a lot of information for sure.
Definitely. Would you say, because I know the naturopath at the time said she sees a lot where women with SIBO or women with gut issues, it's caused some oral contraceptives. So would you say that hormone imbalance could cause gut issues, or gut issues could cause hormone imbalance, or what would be the connection
estrogen,
there?
Yeah, remember estrogen has a huge impact even on the lining of the gut. So again, we'll try to keep it pretty straightforward, so I don't want to confuse people with too many terms, but remember the gut goes from one hole to the other, and there's a lining there in the gut, and you know, estrogen, when it's high or low, can have, because there's receptors for estrogen in the gut, it can have an impact on that lining of the gut, and thus impact things like leaky gut, as you know, our dysbiosis can also impact the leaky gut situation. So oral contraceptives can exert that type of effect. Now we can go into it now in the sense that I suppose we were looking at the microbiome. We also have the component that we call the estrobolome. So those are the bugs that are capable of metabolizing estrogens. And so on the stool test, we often look at a marker called beta-glucuronidase. So whether that's high or low is relevant to hormonal balance, because what happens to estrogens when they go to the liver? They're conjugated, which means a chemical group is added onto them, and then they're sent to the gut so that we can get rid of them. Now, when we have dysbiosis, so let's say we have a case, let's just say dysbiosis in the case of imbalanced gut flora, to keep it simple, that beta-glucuronidase can go high or low and affect how those estrogens are deconjugated and sent back into the system. So let's say, for example, in the case of estrogen excess picture, we might have too little, let's make sure I'm getting that right, too little beta-glucuron. Let me get this straight now. So if we've high beta-glucuronidase,
you can swear here now if you want, or you can.
It's been a long day. So high beta-glucuronidase. Oh yeah, okay. So if the beta-glucuronidase is high, it's deconjugating the estrogen, so that estrogen level is going up into the system. So again, we have this process, enterohepatic recirculation. So if that's high, we're going to be breaking the estrogen off from that chemical group that the liver put on it and goes back into the circulation. So we end up in a case of estrogen excess. And remember, with hormones, it's about balance. So if we're offsetting the balance of estrogen, it's going to have an impact on the progesterone and the testosterone, and equally the neurotransmitters, which is important too. So remember, neurotransmitters are those brain chemicals that govern mood, cognition, and behavior, among other things. So that's where we end up in a tricky situation, is if one is off, they're all going to be off. That's ultimately comes back with HRT too. Sometimes if we change one, it's going to have an impact on the other, or if we give too much HRT, we end up in a situation whereby the receptors desensitize, and it can cause difficulties with that brain hormone gland communication.
Oh, wow.
Then equally, you have the case of if you have low beta-glucuronidase, you're not recirculating enough. So that can be tricky too in cases of menopause. But I suppose it reiterates the importance of having an optimal microbiome for hormonal balance. And again, that would always be the first place I'd start in terms of getting the person healthy. So like I said, if they have a poor diet, remember this can be a vicious cycle too. So if someone's eating a poor diet, they feel shit, and their hormones are off as well. So it can be hard to get that person in a place whereby they're willing to change, you know. So that's again where the clinical acumen and the relationship with the client comes into, and the importance, I think, but often I think people in any profession, it's hard sometimes to talk to people with the language that they understand. So that's a huge part of it as well. Like, you know, I could sit here and say all these fancy terms on the paper, talk about IL-6 and cytokines and everything else, but who's benefiting? It's
goes
just
over
me
the head,
showing off how much I know. That's not helping anybody, like, you know. So I do like to give patients like books to read, books that are not like literature from the journals, but simple books to be able to, they're not taking my word for it either, they're getting this book that explains similar things so they understand it. But again, I have a tendency to ramble, so just stop me if I go off.
It's okay. Go ahead. Everything it's very interesting. I'm learning a lot here today, so that's great. I had a few questions in the group that I had just to get to a little bit. One of them was, so now I kind of know you try to treat everything before the hormones first, but I know there's a little bit of controversial things, not really controversial, but some say do it and some say don't. It's giving estradiol to women who are premenopause. Is that something that you think, no, they should wait? First of all, does it inhibit the production of estrogen once you do that? Is it like testosterone in men, or it doesn't, or?
But remember, there's such a complex web of hormones, and it is always going to depend on the client. So I don't believe in replacing hormone if the levels are normal. So going above that is just going to create problems. So remember, there's all these enzymes that happen in the body and everything else. And so the only thing that I would be looking at, like for what premenopausal women can benefit from. So let's say they've done all the other work, okay, they've managed the insulin level, the glucose and everything else, and they're still suffering from symptoms. Progesterone, I think, is one that's valuable in the second half of the cycle, because remember, progesterone, when we look at the biosynthetic pathways, it's way high up there on that cholesterol, from precursor cholesterol, and then we make the progesterone. And so it does tend to help all the other hormones work quite well. And in most cases, it's the women who experience the PMS symptoms is from that drop in progesterone.
Yeah, it helped me also.
Yeah, it can be very valuable. And again, they don't have to be on it all the time, Like, remember, a lot of, because progesterone has such a huge impact on neurotransmitters, particularly GABA and dopamine. So,
well, it's an anti-anxiety, I think.
Exactly, because
anti-anxiety,
Yeah, and that's because of its effect on our GABA receptor. Remember, GABA is the calming neurotransmitter. If we take a Xanax and we don't worry about anything, nothing bothers us, we're so chilled out. Like, it doesn't matter if the house is falling down around me, or if my dog is barking, I really don't care. Or alcohol, which is probably more common for people, but that's GABA. And it's not unusual for women who take the progesterone, but they're obviously supposed to take it in the evening time, even a low dose like 100, 200 milligram, and they often feel as if they've, had a glass of wine. So, and so, like, sometimes I will actually have the clients take the pharmagaba with the progesterone, and it enhances the sleep quality, and also useful for libido too. So again, for me, it's the last resort to use hormone therapies in a menstruating female, because I've had women who don't have periods for like 2 years and it comes back. Because there's also another thing I didn't mention, and just in case I don't, when it comes to females and hormones, and indeed men as well, like a huge, because of, I suppose, media is always problematic for people, and the general consensus that fat is bad. There's a tendency there, like, and don't get me wrong, I was a victim of it too back in the day, without giving away my age, but to reduce the fat content of food. And we're all so afraid of like fats and all this. I think it's improving, don't get me wrong, but sometimes that's just within our community. So a lot of my friends would be following similar diets. A lot of my friends are into health, but I think that's still a very small portion of the population. But the fats are so important for everything. Like, even like the phospholipids in the brain, we need the cholesterol. We need cholesterol to make hormones. So if the cholesterol is low, or if you're taking a cholesterol lowering drug, there's going to be problems with the hormones. So oftentimes I would have them up the cholesterol levels, deliberately. The GP be freaking out about the cholesterol going up, but obviously with the benefit of other testing to give an indication of the CVD risk, if the periods are coming back after 2 years of none and the patient is feeling amazing, then that's a good sign. So another key one for the hormones is the fats.
Okay, that's really interesting. So just to reiterate a little bit, you do a huge patient history, then you do extensive testing, different things. Do you look at any DNA testing for nutrition or anything like that, or it's mainly,
Yeah, I would do it. Like, the MTHFR is relatively common in the west of Ireland, as you will know from your heritage. And things like COMT, glutathione, SNPs, I do a lot of those. And like I said, because Ireland has such a high incidence of it, it's important to do so. not only for hormones, but for brain health. You know, it gives us an indication, I suppose, of what supplements might be more valuable for the client.
Or someone who's pre-diabetic, who has a ton of diabetes in their family, then definitely maybe less carbs, or at least no carbs in the morning and things like that. And okay,
absolutely. But remember as well, like, because we're talking somewhat about the gut, there's actually a paper, I think it was maybe 2 years ago, that they looked at the postprandial glucose response. And in the past, you know, we used to say there's, okay, a slice of bread, increase the glycemic index or the glycemic load, whichever one you want to use. And it's the same in everybody. But what we know now from this research is that there's actually an interface there, and that's the microbiome. So it's actually not the same for everybody. So in terms of the insulin response, that's determined by what's going on in the gut. Even if we look at metformin as a drug, we know that that has its insulin sensitizing effect by virtue of its effect on the gut. You know, so berberine is another good one for that side of things. But when it comes to
berberine's more natural, I think, right? And it's more
exactly.
Okay, yeah.
But I suppose it's interesting to note that metformin is acting that way. You know,
so I think I missed that. What did you say that metformin does with the gut?
Yeah, I suppose I can't remember now. I think it's Akkermansia. It increases Akkermansia.
Okay.
I think. Now I have to check that. Don't quote me on it, but I'm fairly sure it is. And thus helps the gut flora, so it improves microbial balance. But like I said, I would need to check that again.
Sure, no problem.
And berberine is something that I use particularly in gut as well, you know. So it's also a good antimicrobial for any of the pathogens that are in there in the gut. But I'm not sure where we go with that question.
We're just going everywhere. It's okay.
Like I said, I can just go off on a tangent, but hopefully people get some information out of today.
What other questions that I had? I think I had some. Yeah, there were. A lady had asked the connection between, if there was a connection between hormones and autoimmune disorders, because women tend to have more autoimmune disorders than men. Is that the issue, or that was one of the questions?
Yeah, that is usually the case. They are more common in women. Of course, hormones have an impact, because remember, the hormones, all of the hormones have an impact on many different parts of the body outside of the reproductive system. Now, again, it does come back. Remember, the biggest reservoir of immune cells is really in the gut. So like I said earlier, those receptors are there for estrogen in the gut. It affects that lining of the gut and thus affects the inflammatory predisposition. So again, there's often a genetic component there too. But when it comes to autoimmune disease, there's so much that we can do to abate the symptoms and improve quality of life. So the first thing we will be looking at is improving that gut function, because I see it all the time. The CRP comes down, the autoimmune markers come down, even within a few months, which is great news for people. So I would be recommending a stool test first and foremost for anyone with autoimmune disease. Is this lady pre or post-menopausal?
I would say menopausal, yeah. Yeah.
Okay. So even like, for example, progesterone is hugely anti-inflammatory, particularly in the brain. And did she say what autoimmune condition it was?
No, she didn't. No, I think it was more of a general question, but I think, yeah.
Yeah, and so I mean, if it's a menopausal woman and she is not on HRT, it's definitely worth looking at that. Again, replacing to optimal levels, not going superseding that. So anytime we go above what should be there, like there's going to be problems, like I said, receptor desensitization and problems with the brain metabolism too. And yeah, just cause it. Remember, there's enzymes as well. So even in the female, if someone it has too much carbohydrates in the diet, it activates that enzyme 1720 lyase. So it ends up, we convert too much estrogen to testosterone. That applies more to PCOS than anything else. But I suppose sometimes it's important to explain the interconnectivity of things, and sometimes just giving one thing is not going to sort out all of the problems. But in the terms of autoimmune condition, it is worth considering HRT in a menopausal female. Yeah, I think she would get benefits from it, definitely. And there that impact on the gut is huge for women with issues with the estrogen. But equally, it's important to rectify the dysbiosis that's there. So remember, even if there's dysbiosis, it's not just going to have an impact on hormones or autoimmune disease, but overall health. So often you'll find people, they come in with, like, I might get people with IBD or IBS, and they think they're just coming to me for what's going on in the tummy.
Almost every second or third person, they'll say, I have and I feel like it's such an umbrella term that they use when they don't really know what exactly is going on.
And the funny thing I find, this is the years of experiences. They think they're coming just for the gut. They're like, I just want my gut fixed. I don't have any other issues. How's the energy level? Fine. How's the mood? Fine. How is the skin? Fine. I have periods. They're kind of okay. And then what happens? Lo and behold, they get the gut sorted out. Like some people that have parasites, and they cause a lot of problems for people. Or the weight. People will struggle with weight when they have dysbiosis. And so they come back then in the month, you're like, oh my God, I didn't even realize how bad my energy levels were, or I didn't even realize how bad my mood had got, because now I feel like that's only after 1 month.
Because it's their normal, it becomes their normal, and then they don't realize how much better it can be.
Exactly. And the other problem is society too as a whole, because I don't know what it's not. I think Canada is somewhat further along than we are here. Although Ireland is extremely health conscious, and I have to admit, I would think it's better than the UK, particularly London. So with that in mind, you often have this group mentality whereby, let's say, you might go into a group and say, oh, I feel like so bad in the morning, like, my head is throbbing, I need 5 coffees to wake up. And then someone else beside, oh yeah, I'm the same. So it's like, okay, it's just normal. Like I did actually a lecture many, many years ago in one of the private hospitals just down the road from me now. And it was to the consultants, and I was presenting this case, and I was saying, okay, this guy had brain fog in the morning, his energy levels were dropping, whatever, and his rate the energy out of 410. And the consultants all sat there laughing, like, yeah, should we all feel like that? And I just became so disheartened, because it's like, these are the consultants, like, these are the people at the top of their game. And they're saying it's okay to feel like that. I don't like that. So
no, that's it.
But that just because everybody else feels like that doesn't mean that's normal.
Doesn't mean it's normal. That's it. Yeah.
Like we should be able to live a vibrant, healthy, happy life well up into our 80s, 90s.
Or 100. My grandmother lived to 100.
Yeah, that's great. That's a great number to aim for, So, it's just, I suppose you feel bad.
That's awesome. I think it's great that you're looking at everything as a whole. You're not necessarily giving medications that don't need to be given. You're looking a lot deeper in the past medical history. It's very individualized. It seems very well-rounded. Yeah.
Yeah, and remember, there's another thing we probably didn't mention that has a huge impact on things, and that's the mood. So often symptoms and signs can overlap. So it's easy for a woman coming up to the menopause to attribute symptoms that they have. Oh, I'm just coming up to the menopause, or, my symptoms are because my hormones. And so sometimes it's important, you get a lot from the history. If there's history of mood disorder, that needs to be rectified, and it's often not something people want to do. Even if you look at states like fibromyalgia or chronic fatigue, you're really looking at a picture of depression, like in terms of its biochemistry. Often people forget that depression is not just, is that actually often people think that depression is someone who's pervasively sad and crying all the time, when actually depression is, most people just feel flat. They don't feel any excitement. They don't feel sad. They're just completely flat, and nothing in life they find enjoyment from. Obviously sleep disturbances and everything else, but you can see how those symptoms overlap with a hormonal issue. So like sometimes you have the case where there's women taking HRT, whether it's bioidentical or otherwise, and they say, oh, I still have all my symptoms. They check the bloods, everything looks okay. And then you're like, okay, there's something else going on here too. Remember, the hormones aren't the be all and end all of everything.
No.
And it can be hard for sometimes women to accept it. So like I always say, if it were me, I'm paying somebody to get their opinion, I would take on board. I can agree or disagree, but I think mood disorders are not, although the stigma has alleviated significantly, I think there's still a lot more work to be done for individuals. Mood disorder can strike at any time. It's so common nowadays, whether it's depression, anxiety, eating disorders, addiction. And it's important to be mindful that it can affect anyone. And it's not a sign of weakness. It really is a disease, I think people often forget that too.
Yeah, absolutely. So what would you look at, say, if someone had come to you with fibromyalgia? What would you look at their background, or what would you look at? I mean, obviously, there's much more that you can do than just giving them an antidepressant or pain medication, or what would you?
Oh, yeah. Hey, don't get me wrong. I'm not against antidepressants. For some people, they work really well.
Obviously, it's used for a reason, but there must be other ways that we can.
Exactly. So with fibromyalgia, chronic fatigue, you're looking at particularly the gut. Again, I hate to keep saying the same thing,
no,
but
I mean, it's
it is
your second
super
brain.
important.
Yeah.
Yeah, it really is. Like, you know, and that's important because of how it affects the neurotransmitters, first and foremost, but equally how we absorb nutrients. So it's not uncommon to see the person with chronic fatigue fibromyalgia testing up really low on a lot of B vitamins. Now, they're so important for energy metabolism, first and foremost. Now, often people with chronic fatigue fibromyalgia, because of the state that they're in, they tend to have a history of binging. So, you know, they feel low, and what's going to make them feel better is food. So that needs to be addressed as well. So they can end up with blood sugar issues. You know, they eat, then they're tired, and that affects a whole pile of other things. So insulin management, and again, it's hard to work with those clients. So they need therapy, they need counseling. You know, there's generally a history of trauma with it. And remember, like with childhood trauma too, not everybody remembers it. So that's the way the brain works as a child. If it's heavily traumatic, the brain has the capacity to dissociate, i.e. not remember it. So that again generally comes up for people 30s, 40s, but to be sensitive, like often our clients, they say, oh, I'm pretty sure there's something there, but I don't know what it is. And I will trust their instinct. You know, they're probably not ready for you to come out yet, but you know, we need to be mindful of those things. Fibromyalgia, fats become important as well for the brain, you know, protein, fats. I try to keep carbohydrates as low as possible for those.
Okay.
I'm mediating inflammation too, obviously. Those are huge elements. And like, I suppose it comes back to the same thing. That's why I mentioned that it is a similar picture to depression, in that energy as an experience for us of what goes on around the world is a mood state. So remember, it's rarely for people that they're not eating enough food or that they've exercised too much and that's why they're tired. But the fatigue that people report is more lack of motivation to want to do things, lack of desire to do things, and that's coming down to a picture with, you know, dopamine is an issue there. And with the neurotransmitters, it's an intricate balance too, like it is with the hormones. You mess one, there's going to be an impact on the other. For example, people with depressed states, sometimes it's a serotonin issue, which is the most commonly accepted opinion of what goes on in depression. But for other people, it's a dopamine issue. So you give them an SRI, so serotonin reuptake inhibitor, they're going to feel much worse if a person who needs more dopamine, because you're ramping up the one that's already normal, and this dopamine is going further down. So sometimes they do well with other drugs that are more dopaminergic, and again, that comes down to history taken as well.
That's a good point.
Fibromyalgia, chronic fatigue, yoga. You know, I always like to use things that, because it's not uncommon again for that to a huge stressful event to precipitate the symptoms. Now, oftentimes you find there's a gap between the stress abating and the manifestation of symptoms. And again, I see clients, they come in, I don't understand why I feel so shit now, because like when I was stressed, I coped fine, and now there is no stress.
Because everything is coming out. I always find that, have you ever noticed when you're studying for a big exam and you're fine, and then when the exam is done, or you're you know, you had a big project at work or whatever, when it's done, it's like, then you get sick, or then you get super tired, and then like all the fatigue, all the stress is coming out of your body. It's like,
because remember, we have adrenaline that keeps us going during high stress. It makes us feel great. And you know, the problem is then when the stress is not there, the immediate stress is not there, then it becomes more apparent that we probably burnt everything out. So that's when you start to see people, and that's why they often struggle to connect the two, because they're like, well, like, this doesn't make any sense. But like tools that, let's say, don't require, like yoga, like, is so underrated. You know, if you look at the literature, it's huge. Yoga in particular, in terms of how it influences the brain biochemistry. And again, one session is not going to do it, but consistent practice over time. It's not just about stretching the muscles. Like, don't get me wrong, I'm not talking about like stuff where they like twist the arms and all this, but you know, a slow mindful flow yoga can be hugely beneficial for the brain. There's actually also an app that I've been looking at and using with some clients and doing myself. It's my own therapist actually that recommended it to me, but it's an excellent app called Auric. And it's developed by sound engineers that you can listen to your own music, but it changes the frequency again. I'm not an engineer, I don't know the ins and outs of it, but what it's designed to do is stimulate the vagus nerve. So you can listen to your own music, and it tends to promote that parasympathetic activity. Obviously, I'd advise listening to calm music, not like, you know, dead man's house dance or whatever, you know. But it does have a huge impact, you know. And I suppose one of the great benefits of the phone is we do have access to apps like that. I would generally tend to have nothing good to say about bloody phones, but I think that app is exceptionally. I hate the things. But yeah, it's worth it. If the listeners want to try it, it's well worth it.
That's really good. I think, I mean, sometimes it's just the little things of like incorporating like, you know, a 10-minute morning routine every morning, or even like a 5-minute journaling before you go to bed every night. Just something to just like consistent, and going to bed at a consistent hour every night, and sleep hygiene, and just little things like that.
Yeah, you know, oftentimes people want to take, they want to do something like take a supplement or take food or whatever else, but they can get far more profound benefits from doing things that probably going to take a little bit more work to get into the habit of it, but far more profound benefits, as I said, like simple things like walking in nature, you know, like do you actually take your shoes off and feel the ground? Like it might sound airy-fairy, but like it is a great tool. Like being around animals and all the rest, those things are super therapeutic for, given the society that we live in. We're just like so bombarded with so many artificial things and stupid stuff on social media, and just consumerism in general is just causing problems for people. Like
Absolutely,
if we could just learn to appreciate the simple things, like a sunrise. Like for example, I went out with my dog this morning to watch the sunrise, like up in the hill, and it was just spectacular. Like, you know, like that puts me in a good mood for the whole day. You see, I actually saw the moon coming down and the sun going up. It was amazing.
That's amazing. Fantastic.
You know, yeah, like, and just simple things like that can have such a huge impact on your motivation, your mood, and your drive for the day, you know.
Awesome. I don't know if I just want to see if I had any more questions from anyone, just to make sure that I answer. No, I think I don't know if you had anything else to add that you wanted to add today, or.
I'll be guided by you, I guess. I think I've gone way off on tangents, as I always do.
No, it's like, great. It was fantastic. Yeah.
Okay, I hope people get some value from it.
Hopefully we'll have you back on again, because it was brilliant. Thank you very much.
I loved you. Thank you, Angie. I really appreciate you having me on.
Thank you.